and verify that some of us are here anyway.
Member Andrew. Member Certain.
Here.
Member Chance. Member Cornell.
Yeah.
Member Ferrero. Member Hart. Member Labarda. Member Peterson.
Here.
Member Twombly.
Here.
Do we have anybody want to, participate? Okay. All right. Okay, motion on
I guess we can't officially take a look.
Oh, yeah, you can't.
But we
You can't do
can
that.
follow, I don't have any changes to the agenda, or I'll make them.
Okay. All right. All right, well, who's gonna carry forward on the presentation? Chris.
We're gonna get us started.
Chris,
Yes.
looking forward to hearing the presentation.
So I have to leave for going to city meeting, that's such a curious.
You guys see, you want to speak to my lease, and can't have to that too.
You know, I want to actually attend the beginning, so I can make sure that. Everybody doesn't. This one has to say the same thing.
Good afternoon, Christie.
Hello. So I have shared my slide, and so I'm gonna walk through the slides. Then we'll be able to have some discussion throughout the presentation. I know there are specific areas that you guys are interested in ensuring you hear about, and so we hope to get that moving along. So next slide.
We have 5 people, so is that enough, or do we need 6?
So I move approval of the agenda.
Okay. Have a motion, a second, any discussion on the motion? There being none, all those in favor of the motion say aye. Aye. Motion is approved.
Alright, so I am presenting the healthcare RFP that's specifically for children and youth in our area. The first slide, I just want to provide you guys with a recap of kind of how we landed here. And this is specifically for access to healthcare for children and youth in our county. That's the only RFP that we're talking about today. So this initiative is a direct result of our strategic plan. It falls under goal 1, which is children and youth are healthy and have nurturing caregivers and relationships. And the board has already allocated $600,000 specifically for this funding opportunity. What we've done thus far, is we started some internal planning. And the way we've done that is through listening project results, data that we collected, environmental scans. What you received in your board packet was an environmental scan. It was also some feedback that we had seen when we needed to, or had received when we needed to publish the board packet. Since then, we have received some additional feedback. And internally, the team got together and we reviewed what you all have, and we came up with a couple ideas, and then we have some additional information to share. Next slide. So with the internal discussion that we had, the purpose and what we'd like this RFP to be for is to expand access to quality healthcare services for children and youth of families who reside in Alachua County in the following areas: dental care and education. We initially talked about vision exams and making sure children have access to glasses. Our data isn't supporting it. We wanted to include it. We looked at the environmental scan. I had Bonnie do some additional digging into some local information, and the data really doesn't support it. So it's there so that you guys see it, and in case you have some additional information. I didn't know if the county had some additional information specifically related to data, or if any of you have that information, but we couldn't find anything significant through our screenings, through the school, and through charts and all the other places that we looked. So I left it in that slide just so that you all would know that we were looking at it. But I don't think it's going to get included unless we make a different decision here today. Also, increasing access to healthcare services in our rural communities via mobile health clinics, and then funding existing wellness or healthcare navigator programs. What I am going to do, next slide, is talk a little bit about each of those individually. But before I do that, I want to bring up the fact that we know mental health and special needs is huge. It is a significant concern, not only to the trust, our providers, but to families. And we think that deserves its own funding opportunity. For us to include it within this one RFP, I think we want to look at capacity. We want to create opportunities to talk about this and only this. We want Maggie to be present because there's a lot of expertise there that we'd like for her to be involved in, kind of help us, be our expert on the board as it relates to mental health needs. And then we're making some other connections as it relates to special needs. So, but just so that you know what we are doing as we build to that, we are serving on the Alachua County Mental Health Committee. We are also participants on the Mental Health System and Care Committee that the school district is facilitating. Of course, we are funders of mental health programs. And then other funders in our area for mental health programs is the Community Foundation, as well as Alachua County through their funding, through their funds, through CAP and choices. And so we're not forgetting about special needs and mental health, but we do think it deserves its own funding opportunity and being strategic about how we're going to fund it.
Ken.
So again, if you want us to ask questions now as we go, is that okay? Yeah, 'cause
Okay.
my comment on what you just said as far as CAP and choices is that I know the county does spend a lot of money, mostly through Meridian. But I would say that there is definitely not a focus on children. It just may be more happenstance. And so I think that's an area that I support separately funding this line item. If there's an opportunity to do that within our strategic plan, because I don't think we're doing enough at the county to really address children or families with children that have mental health issues. And I think it also ties kind of right into what we're talking about, the countywide, citywide kind of violence too, because there's just a lot of need there for us to focus on kids.
Okay. We are.
And I wanted to ask if the current funders, like the after school time providers, they have mental health as part of their RFP. Would they come in on this? Because I know that is a challenge. I know 2 providers that have mental health counselors on. Would that be separate from this right here?
Yes, it would be separate from this. The committee that I mentioned earlier, the Alachua County Mental Health Committee, that committee is looking at the gaps.
Okay.
So we're looking specifically at gaps, and we're looking at making sure all the boards of those that are participating have a report back to what the recommendation is. So once we have that recommendation, we'll be able to come back and say, this is what the committee is hoping to address within our county and the part that the trust should play in that.
Oh, good. Okay.
And Kristen, does that include the outline areas?
Yes, it does.
Okay, that's great.
And special needs is so broad.
Yeah, it is.
Do we have a definition or a working definition?
And for today, we don't. But when we release our RFPs, yes, we will have a definition. We'll be able to say exactly what that means. Is that occupational therapy? Is it respite? Is it, we'll be able to have a definition of exactly what we intend to fund.
And Mary, we will come back and do this again. We'll have another workshop specifically about mental health and special needs, and then defining it, what areas we feel the gaps are. And the committee that Christy is referencing is the committee that came out of our joint meeting with the county when we were tasked with the literacy, and the county was tasked with mental health needs. So that's the committee she's talking about that we're also participating.
Gotcha.
May I ask you a question?
Yeah.
So is the county going to perhaps start honing in or allowing more allocation of dollars for children?
Yeah, we actually in the CAP, we just we just approved the revision of CAP funding.
Mhm.
And focused on, it's historically been poverty, seniors and food. And we added, children and children education. And we also, I was able to, at that county meeting, say that, the Children's Trust funding is not, it is not to supplant existing funding, it's in addition to. And so two of the three or 4 or 5 commissioners really weren't on the board when it happened. And so that needed to kind of be set again. So they understand that, there's a need and that the Children's Trust has a funding source, but that we need to continue to increase funding in that area. So I think so, short answer, but we also talked about increasing funding for CAP. And I think the amount of dialogue that the county and trust is having and the county and the school board's trying to have, the focus is on kids. Yeah. That's what I'm feeling.
Thank you, Christie.
You're welcome. Next slide. So what have we done? As a reminder, Prismatic. So we reached over 1,200 individuals via our contract with Prismatic. Since then, we have utilized surveys to learn how families would like to learn of available resources in our area. We're currently building relationships with youth councils because we'd like to know what they need. And we'd like for them to tell us in their own words. And we'd like for them to be able to be open and honest. And so we're building relationships through Liz, who's who's doing a great job with community engagement. So she built some great relationships throughout our county with youth council. And we'll be able to go to them periodically and get feedback about what we're funding for them. And so there were surveys that were created specifically for them. In addition, in addition to what we've already collected, there were surveys published in English and Spanish for providers, parents, and the community. Next slide. Whether families provided responses to surveys or not, they also had the opportunity to participate in some Zoom meetings that we had. And so the listening continues. That's something we promised when we completed our strategic plan. And so we had 2 Zoom meetings. And some of the information or concerns that we learned out of those Zoom meetings specifically related to this RFP is, again, dental. For healthcare is the greatest unmet need for families in our area, that dental. Navigators, we heard a lot from providers as it relates to not only if I'm a provider, but then I also need someone to sit there and help that family navigate the resources that are available to them. That could be connecting them to healthcare. If there's a child who doesn't have Medicaid, maybe they qualify for kid care. So having someone not only say this is available, but walking them through the process. Also connecting them to other resources, making sure they know where our family resource centers are, making sure they know about our summer camps and our after-school programs, making sure they do know how to access our mental health programs that we are funding.
Remind me what the difference between a partner and a provider is.
So a provider is someone we are funding.
Okay.
A partner is someone who is also a provider of services in our area, but they're not receiving trust funds.
Okay, thank you.
Other areas that came out of our surveys or our calls that were concerns to the community, vaccinations and access to those preventative screens for children and our older youth. The cost as well as transportation and a lot of concerns as it relates to our rural areas. So what I'd like to do now, and where I think the bulk of our conversation will be over the next several slides, is really break down what we hope to fund in these areas. So the first one is dental care. We're proposing RFP funding for dental services for children and youth residing in our county. These services to be held in community-based settings and to include non-traditional hours. We know that it's difficult for families to get off of work sometimes. For jobs where it might be easy, it may not be a job where they have PTO. They may not be able to utilize that, so that means we're cutting into the cost of their salaries. We also like our dental provider to serve on any local healthcare task force or dental healthcare task force. And we think this is important because we want them to be involved in conversations where policy is being created. And sometimes policies are being created that may cause more gaps. Or there may be an opportunity for a provider that's working with families at high risk need, and they may hear something that says, we think this is going to be an issue. One example is that we know now in Alachua County, families have to opt in to dental care services that are at the schools instead of opt out. And so for families where the form is not going home, or there may be a stigma, or there's an issue, we want to ensure that families have every opportunity to access these services. And so if our dental care providers are involved in those conversations, have the opportunity to present and state why this can cause additional gaps, we want them to be present in those opportunities.
Well, who determines that policy? Is that at the school board level?
So that would be at the school board level.
So can we talk to Tina and say, can you make this from opt out to opt in? Then you have to opt out, otherwise you're opting in.
Right.
I think it used to be that way, and there was in the last session, it was something that changed with that parental bill of rights
Yeah.
thing about
Same thing
healthcare.
with
and all that.
vaccines, same thing.
Yeah,
Same thing with that.
right. So it's like,
Mhm.
Right.
but
Yeah.
The goal is so that they are there to have the conversation.
Okay.
The goal is also to hear those things and then potentially create campaigns, media
Right.
campaigns.
right.
This is now done this way.
Mhm.
Here's how you can ensure your kids have access
Right.
or these services.
Yeah.
And then lastly, we're proposing that our funding supports the cost of hiring community health workers. That goes back to that navigation and how families we can be sure that families have access to all the information. You're going to hear me say community health worker a couple more times because we want to ensure that for every component of this RFP, that there is funding there for them to access that.
Christie,
Yes.
can you give them a definition or tell them the difference between the navigator and the community health worker?
Well, okay. So we currently fund navigators through Partnership for Strong Families. The navigators are individuals with degrees who have years of experience, who have worked within the community. They understand the resources. Where a community health worker is an individual, could potentially have a degree, but most of the time they are a trusted individual in a neighborhood or in a community that families are already going to. They already trust them. Their word is their bond. And so what the community health worker program that we currently have in our community does is also adds the actual resource information to ensure that they know exactly where families can go. They have the phone numbers, they're able to make connections for those families.
Correct.
And so that is how I would describe it.
Perfect.
Okay.
And I
That's
just
really good.
wanted to, I asked you to do that because I know I kept internally, I was like, now what's the difference between the two? But the county is already helping to fund the community health worker program. So it's a program that has been around, our understanding is for 3 years. And they are pulling people from the community, giving them training. So they are trained and then they're going back into the community, working with different organizations. So we're trying to partner with them to provide more of these folks who really are already in our community.
So they get a stipend as well as material to hand out to people, is that?
Yes,
You got it.
and actually resources directly into the county,
Yeah.
like that, they're really the neighborhood liaison.
Yeah,
That's what's
exactly.
going on. They got access to Gina or whoever, Claudia, whoever's dealing with that in the neighborhood.
Could you envision them being, knowledgeable about other areas of health beyond dental? So could the dental health be, for instance, the person who knows about the visiting RN program?
So, what I've seen thus far is that they are normally an expert in the area where they are being trained.
Okay.
However,
Place.
yes. However, I love what you're saying, because there could be a way for us to have quarterly community health worker meetings, or make sure that they're attending, the Family Resource Center quarterly meetings, because then that's where they can learn of the different resources, and begin to, increase their knowledge on other health topics also. But normally, wherever they are placed is the expertise that they can go. Yeah.
But to Mary's point, I think it is a huge opportunity to leverage. Once we set this system up where they're getting information and informing the neighborhood.
If you become a go-to person and you have multiple age children.
Yes.
Reducing silos.
Yes.
Say that again?
Reducing.
Sure. Well, even if the workers knew each other, and one expertise is this and one is that, and they knew how to connect with each other, that would help too, so. But the cross training would be huge.
And we know families sometimes feel like they're getting the runaround. And so if I'm meeting with you at the dental clinic, you also know how to help me get services for something completely different, healthcare, immunization. So that's a great idea.
Wig,
Yeah.
Yeah.
And do you have any idea how much y'all gonna allocate towards dental of the 600,000?
So I envision the provider, this will not be a separate, line item within the $600,000. The provider will need to identify within their proposal that salary for a community.
Thank you. So I just want to throw this out there. I love the US Smiles. I love that, right? But what I don't like is UF's administrative costs where so y'all know, I'm getting on my soapbox and asking for an exemption for that, because those dollars that they're taking for administrative costs could be used to serve more children. And they're in here in US extract a lot from our community without giving anything back. So that's my spill on that. I have to say that every time.
They'll tell you differently. Frustrating.
Yeah, so I'm insisting, I'm only one, but I do insist, I think that we should lean in on that, they take these resources and they're already going out and wherever they get their administrative fee from, get that, but let us use these dollars to reach more students, more children, yes. I'm sorry, I have everything that I feel like I have to say that, because that 18 or 28%, whatever it is a lot.
So I believe it's 10% for our budgets. Currently, every provider is allowed 10%. And
Well, if you reduce US to 10%, then that's 8 to 10%.
Because normally it is, I thought it was in that 18, 20 something percent, so I'm shooting for zero, but okay, I just want to put that out.
We're done with interrupting you for the moment.
next slide.
I have a lot of questions about this week.
Okay.
I like how you warn her.
For our healthcare services in rural communities, we are proposing RFP funding to increase healthcare accessibility and improve overall health outcomes for children in our rural communities. Our goal in funding mobile health clinics is to address both medical and social determinants of health. Applicants for this would also address the cost of healthcare concerns that we've heard from families, but most importantly, connecting families with healthcare coverage and helping them establish primary care doctors and routine care. The feedback that we received was significant as it relates to lack of providers in rural areas. And we all know that transportation is a big deal in the greater Gainesville area, but also specifically our rural areas. And so when we heard that, not only from our listening project over a year ago, but again, as we began to listen during our virtual calls and then from our surveys, we are proposing that we see if there are any proposals for mobile health clinics working with children and youth in our community. Now, I had an opportunity to email Dr. Grant Harrell and just ask, what do you see? Because he runs the mobile health clinic for the University of Florida. What are you seeing when you go out? But he doesn't work with children. Which he said that, he was like, I can tell you there's a need. However, our current model does not work with children, it's just youth. And I will stop there for
Just youth? Is that what you-
adults,
Adults,
excuse me.
okay. Okay, y'all will kind of send all this rehash of all the measurables. And the numbers for Washington County are pretty much not very good. So is there a way, we have the programs, once where you establish something, and I know that we've done something with prenatal. We've done some things with prenatal now. And we have the program once you've had the baby. And maybe it's primarily because the numbers, are somewhat dated in here, but is there a way to incorporate some of the information that we have been given here into these clinics as well about, inter-pregnancy interval, the first trimester, it looks like we're actually above, the numbers, so that's good, but it's still only 80%, so. But then the number of children that die, early in their life, is terrible.
Yeah.
And especially, it's not great for the state either. That the numbers aren't very good. So, what can we do to, do something as far as that is concerned? Can we incorporate some of this into these clinics? I know that, do you think, I guess my question would be, do you think that we've done what we've done with working with some of the OBGYN people is enough? I don't think it is, because it's probably not encompassing the rural areas. Is that something also that on these things that go out to the rural areas, mental health, the number of people that are feel alone or depressed, the children, some of these things, how do we incorporate that into what we're going to do? Because these numbers are terrible.
So when we looked at the data specifically for health, we want to be able to address primary healthcare concerns for 0 to 18.
Okay.
Really school age children. Do our 3rd, 5th, 9th graders have access to a doctor? Are our middle school and high school teenagers getting the necessary screens to reduce risky behaviors? They have access to STD, HIV testing to make sure either preventing STD, HIV, pregnancy, or treatment if needed.
And there was also something about weight, obesity, and are there things that we can do as far as that in these clinics for those children, because or the parents of those children, because it used to be fast food was cheap, but it isn't cheap anymore. So it may still be cheap in comparison to everything else, but it just leads to so much more. Is there something that we can do to incorporate some of that indoctrination, if nothing else?
That is all a part of, that is all a part of primary care. If you are seeing a doctor, those should be the conversations that are being had as it relates to nutrition, healthy eating, immunization, screens, healthcare screens. That is all a part of the healthcare specifically for all of our areas, but that is what it is we're trying to address.
Well, is it going to be a case where they're so overwhelmed, the people that are providing services so overwhelmed by numbers that they're really, it's just get them in and get them out, where they really don't have time to go into the things that need to be gotten into?
I cannot determine that at this point, but that is something you need to know, because what that would show is that there's a capacity issue within our area. If our mobile health clinics are being overrun by people who need care, then something's wrong. That means we don't have enough doctors who are taking the type of health insurance that they have.
Right.
The doctors are overwhelmed. If we're seeing that, then that's a system of care issue for sure in our area. I think some of this will pinpoint what we need to know as it relates to what's happening in our community.
Well, I know that there at least there was a program, the doctor, you can help me with this, that there were a group of doctors that went around and, you know, in certain areas, I don't know if it was in the rural areas. I don't know if it, was that through the health department?
Yeah.
Through the health department, do y'all know anything about that one?
I don't, I have not heard about that one. We were able to review the county health department plan to look at, a lot of the areas. There was a lot about dental, a lot about, preventing alcohol, drug abuse, and this is the last year, so we're gonna be redoing that again, so it'll be interesting to see what, gains they made for their plan. But what I think I hear you saying, and you'll correct me if I'm wrong, is
Not
that
very good communicator, so.
you want to ensure that the impact of this will address specific concerns as it relates to nutrition, health, making sure they're screened. I think navigators specifically for this one is going to be important because they need to be establishing a relationship with a primary care physician and going to those routine appointments.
Right.
In a few, we're gonna talk about performance measures, we're gonna talk about impact and how we, what we think we'll see over the long term. But that's what I think I hear you saying, but I wanna make sure.
What I would like to see is like, a significant drop, what do we have, 6 years left? 6 years left. In the next 6 years, the numbers go down or up significantly, whichever the.
And which one you talking about?
Yeah, which chart are you looking at?
This is in this,
What page? First
The environmental
trimester.
the
scan.
first trimester, from there on, you have a whole bunch of different statistics in there that are,
Well, they're not all bad.
not most of them are, but we are better than some. Thank God for Escambia County.
All of the,
One thing I noticed, whatever you can do to help Hawthorne, oh my God, you've got to do something to help Hawthorne, definitely. Yeah.
so prenatal care, so pregnancy is covered, but we fund, we don't fund. So the state funds pregnancy and home visiting for pregnant women. That's through Healthy Start, and then there are other programs also. Healthy Star's not the only one. We fund babies who are born within 7 days. That's our nurse home visiting program. We do fund, our program that's in the OB office, so that's pregnancy also. And then we have other programs that are also working with parents who have children birth to 3 also. This pot of money would be older children.
Okay,
Because Healthy Start and Healthy Families and Hippie and all of those, they are serving as the individuals who can help families navigate all things, including early identification of social, special needs, immunization, pediatric care. That's all covered, and I'm not saying the state funds 100% of it. I'm saying that there is, however, money that is leveraged for our county specifically for that age range. They look at SIDS, they look at, the infant mortality rate in general. They look at, the, mortality rate for moms, moms who are down. So they're looking at all of that. And what we're hoping to address is social determinants of healthcare for the older kids.
okay, my immediate reaction to that, Christie, is,
Yeah.
how much of what the state did or what the state paid for by the time that child is born, what could they have potentially done so that we don't have a number of infant deaths? I mean, is it after they're born, that we should be doing a better job or trying to put more resources for, or is it because something wasn't done? And that kind of falls on, I guess, Bonnie, for, going through the data to see, did they not get something early that caused that baby to die when it was born?
Gotcha. So there is $450,000 that you all have allocated for maternal child health. And Mia is going to be presenting, because that's all of that early childhood, that prenatal, all of that falls in that. So we, the trust, we have allocated $450,000 to look into exactly what you're asking for.
But that's not this.
That's not what.
That's not.
Yes, right, I understand.
It is happening. We've been meeting with, Dr. Harris, Dr. Karen Harris, we've been meeting with Dr. Anatola. And so that is happening. We're looking at it where Gonna bring back to you all sorts of recommendations as it relates to having doulas, to be able to work with the population that's seeing the most infant mortality. And so we are working on that.
I appreciate y'all putting up with the question, and you too, Christie. So Amelia will be able to tell us after meeting perhaps, be able to tell us if there's some sort of gap that's taking place between the state finances and what we're doing. Because most of these things that are on here, not necessarily say like the infant deaths.
Yeah.
That's after they're born, so that's kind of on us, and it was, that was frustrating. The number of deaths taking place, because it was way out, as far as the state and the other counties. So, whatever we can, I mean, this is,
Yeah.
you think about Alachua County and all the health care stuff that was here, why is that happening? That was my.
There's a connection. I think sometimes there's that gap that's there, and that's also the gap I think has been persistent in when the newborn home nurse visiting.
Mhm.
They've had plenty of resources, but the needed population, I don't think they've gotten into that. And remember, I made the,
Going to the OBGYNs and specific looking for the socioeconomic.
Trust factor. Remember, I told you, people don't want people coming into them, their space, collecting information that could possibly be used against them. There's a lack of trust. So I think having the navigator or community health worker, or someone from their community that can help them, I think may help us bridge the gap, because I think there's funding in different programs that are there, but the utilization is not with the affected population.
Right, because it's volunteer based, so they have to want.
They got a lot to do that. And honestly, I have shared with you all what folks have told me as to why they did not want newborn home nursing folks in their space.
Right.
I don't want, so I don't rehash that, but I think your concern is, I think it is valid, but I think it goes back to connecting people with the resources. Like, we have their resources in an area and programs, but if people are not using them, we're not going to see the impact in the data. And so we got to figure out what's the breakdown and why they're not using it. And with the newborn home nursing, like I said, I've had several families of color to tell me I was scared letting people come in my house. I don't know if they're gonna come in, Tina, and they're gonna look and they see something, and then they go back and tell DCF there, I shared that with Sherry a couple times. And so.
And those are the kinds of things that you almost need living them in meetings, like those trusted, they're not the navigators, the other ones, I'm not gonna say.
Community health.
But when we were doing some community engagement, we would find a neighborhood, we call them the natural leaders of the neighborhood, same thing. And going and seeing if they would host a meeting of information. And then bringing cookies and coffee and then having the neighborhood women come in. And I think that's kind of what we're missing, because if you tell people, oh, I've got this program I'm gonna refer you to.
Right. I think also at the medical level, go ahead.
Well, I was gonna say, from what I'm hearing, could we make every RFP applicant show us, basically require, what is your community health worker plan?
How you gonna connect somebody with the resources?
It's like make that a requirement, and that to me is a game changer, because that would ensure.
Define your engagement. How are you gonna engage yourself in the program?
Define your engagement, how are you funding it, and what is your plan? And then if they don't put a community healthcare worker in there, then we know that they're probably not gonna reach some of the folks that we need.
The hardest to reach people.
Yeah, so I'm totally in favor of making that an RFP requirement.
And I think it also speaks to the cross pollination we're trying for, sorry. To Lee's point, if, he's looking at one chunk of data, but if somebody helped me solve a problem in one area, I'm more likely to trust them in another area. Or refer them to my neighbor.
Yeah,
Right.
yeah.
Right.
And I think it can build on many other things too. Gun violence is one of these comes back to my mind as far as, like having doors at Lincoln Estates is so powerful for the county. What's that?
And it's following.
And it's filing, they're filing, yeah.
Okay, I have a question on for missing.
Okay.
Love workplace. That's after the baby's born, but it's really a reflection of, pregnancy. So how y'all do that? Because we're not good on that either.
So that's all maternal child
Yeah.
health, but I will say this. I think that it's gonna be important that we have the experts for maternal child health come in and explain a lot of things. I think not every low income person has a low birth weight baby. Not every high risk situation is experiencing mortality or infant death. And so that infant death number consists of a lot of things. Sometimes it's a lot of breastfeeding moms because they don't want to take the baby out of the baby.
They won't do what?
Take them out the bed, co-sleeping.
They want to co-sleep instead of breastfeeding and then putting them in the bassinet next to their bed. So we have to be very clear about what it is we're thinking the infant mortality is. And I think the folks who do that are our partners at Healthy Start. They are funded by the state to do exactly what we want to know. And so we can have them come and not even talk about what we fund them for, but what do you see as it relates to maternal child health, infant deaths, what is causing it? Why are babies,
I would love that to happen.
We absolutely can do it. I think that'll answer a lot of your questions, for us to make decisions about.
But my immediate response to that would be, okay, that can't be the only thing, because that's probably happening in every county. You know, it's not just gonna be an abnormality and just in here.
Yeah.
So,
Thank you. Christy, are there any mobile health units that service youth? 0 to 18, like I know about the one that Dr. Harold does, that Gator one in the Shands, but I haven't ever seen, but I mean, it doesn't exist, so I'm just asking.
Right, and so what this RFP, the first person I went to was Dr. Dr. Knight. And just because of our relationship with SWAG, but that is something we have to see through this RFP. We have to put it out there and say, this is what we're looking for. We want someone to propose these specific services. You may have the infrastructure and all you need is the physician or the nurse to be able to expand your services. Because like Member Cornell said, we can't supplant. You need to come and propose to us how you're going to expand. And if expanding is, I'm going to serve a completely new population, then that's what we want to see. So I can't really answer your question. We're hoping to see what is, is in our community.
And so if we don't, given that, like I know in a couple of the rural communities, they have like clinics that are there. Like I think they're like by physician based, like there's one I'm thinking of in Alachua that's on 441. Like could they in theory apply for this, like to be able to reach people who don't have insurance or whatever? Like I don't know if there's one in High Springs. I think there's a little small clinic, I think in Hawthorne. I don't know. I think it's a private physician that operates it, I think, but I'm not sure. I'm just trying to think of like some ways we could reach outlying areas that may not have access, and the transportation is a barrier, because if they could visit a facility in their community.
Well, we're hoping that they're already doing that. So we're hoping to increase their access to service. And so if you are in Hawthorne or Alachua and there's a clinic there, we hope you're already doing that. We hope that that location is marketing their services and is well known in their community so that families are going there to get services. That is what they should be doing.
So what if it is an uninsured or an underinsured family? They may not go to that facility because they may not have the means to be able to do it.
So what that means then is if the board is interested in us allowing this RFP to cover care for someone who is located in their area, but I can't see everybody because they don't have the health insurance, then that's a decision we can make today.
Well, I was just trying to figure out if that was a purpose of this RFP, if it was strictly to mobile access, like a bus that would go from community to community, or if it was a facility that is in an area that would like to be able to, like Acorn, like the clinic I have mine is Acorn Clinic.
Yeah.
So we did have the conversation, well, are we just talking about vans? And are we just talking about buses? No, we did talk about if there is a clinic that can pick up from their facility and go somewhere to where services are needed. Now, for an example, if there's a small resource center in Hawthorne,
Right.
If a doctor from wherever says, I can see patients there, I just need some more funding to relocate myself 2 or 3 days, or 2 days probably at most, in this community and see patients. That is what we discussed for this RFP. But to your point, the conversation is on the table if we want to also have that discussion about somebody, I'm here, I just can't see them because of cost concerns, because I'm having to charge them out of pocket, because there's no insurance. We can absolutely have that conversation.
Well, I would challenge y'all to try to find answers for Hawthorne, because Hawthorne is terrible. I mean, the numbers there were just mind blowing.
Waldo, Archer.
I was gonna say, we're a community. I mean,
Just everything. So I looked for Waldo and I looked for, both Waldo and Archer, because I know that, the three of those are kind of the areas in the county that have the worst, but Hawthorne is unbelievable.
we've done
It would be a
these.
good idea to have one of the navigators or the community person at the clinic to say, okay, they can't do that. But here's where you can go,
Yes.
wouldn't that make sense?
It does make sense. We can also, within our RFP, if we find that those are areas we want to target, we can allocate points. If you are proposing to include services in Hawthorne, Waldo, and Archer, you get more points. We can do those things to try to see if we
I do think that rural access shouldn't be weighted heavier.
rural access. Yes, so this is the only rural. Yes, it is only rural, but we can all
In my opinion, it's not rural in the sense because they have more things that are west. But in the eastern part of the county,
Yeah.
where there is less access,
So I have a point.
more purpose about it, there's some areas that don't have as many, Waterville doesn't have a lot.
Yeah.
Hawthorne doesn't have a
I
lot.
think you just need the data to justify that.
Yeah.
Like number of provider,
Yeah.
it's this type of data.
So we work directly with the county to identify what the rural areas are. They give us rural and unincorporated.
Right.
And so that is how we have defined that. We work with the county to give us that information.
So I see here, in the packet it says our municipality, but that has all municipalities. So can you just not, I don't want it like a long thing, briefly, could you tell us the data that the county says, what they're considering rural? Because like I said, for me, I'm in Newberry.
Yeah.
I live west
Yeah.
of the mall.
Yeah.
And it is rural, and I'm in the unincorporated area, but I drive like a few miles.
Yeah.
I got a car and I drive a few miles and I got a doctor. My primary care and my dermatologist is like 6 miles from my house.
So I don't have that email. I don't
Okay.
bring it with me, but at the county, they were able to send us that full list because one of our after school is our after school RFP where we gave additional points for rural and unincorporated rural. And so I have the email, I just don't have it.
Okay, that's fine.
But we do have the information.
Oh, sorry.
I mean, I think we talking about on page 8. It really hones in on food stamps, Medicaid and other public insurance, and then household income. And also in Waldo are the outliers there. And so I like what Tina said, we set those outlier cities within our county.
Yeah.
If you're offering services in those areas, you get bonus points. I think that makes a lot of sense.
Yes, we can do that for sure.
And that's database, data driven based on the needs.
Can we go back to the conversation real quick? I just don't want to miss it.
Did we sidetrack you? I'm so.
I don't want to miss whether we are all saying that, a provider in a community that we want to see services in, can apply for funding to ensure services are provided to those who do not have healthcare insurance. They can be in the rural area, they just can't serve them because for funding issues, as relates to costs. Are we saying that within this RFP, a primary care physician can apply for dollars to cover the cost of uninsured?
I think so.
If it's like immunization, if it is a physical, some type of screening and stuff that's up there, if it was something that a mobile clinic would do.
What if it's a health?
I'm okay with that because the kids.
Yeah.
Don't determine whether or not their families have health insurance.
Right.
But they have the need. So I am okay with with that in the RFP.
The one thing I would ask is that if that provider is looking to use our dollars to pay for like the doctor visit, that they have the capacity in-house, and we've partnered with providers before doctor's offices to help people apply for their Medicaid. Because a lot of the people that are uninsured could get Medicaid if they knew how, or knew how to follow up, or had somebody that like just put their hands in the process. Yeah.
That's a good point.
So I could see funding the first appointment to get them in, but then they should explore that Medicaid eligibility to see if.
I agree. I think they too need to commit to
Yeah.
having someone in their facility that's helping families do that.
Right.
That's where it's gonna come. We also have to then think about cost. Are we talking about a sliding scale fee? Are we talking about what the health department covers? So when we go this route, we just have to make sure that we are not opening up an opportunity for a doctor to charge their full-blown cost of what they would charge a healthcare, insurance company. Or are we saying you must have a sliding scale fee and that has to be included? We can't make it up as we go.
I think so.
We don't have that much money.
No. One provider.
And so so my suggestion to the board is if we're gonna go this route, that one, they have to commit to having someone on their staff that's gonna help families, because we're talking about community, they can have a community health work also. And then we're also requiring that they have a sliding scale fee. One that matches the health department, if
Okay.
I understand it.
One thing that drove me nuts when we first got in the county, and hopefully that y'all made it even better. The county was paying full freight for the charges at Shands and stuff. There was, what they allow, what they charge, and what is actually ends up being allowed is the difference is astronomical. Like it's almost, cents on the dollar is what they actually end up being paid. So what a doctor's fee is and what you actually end up, realistically getting it can be very, very different. And we got it down to 50%, which still exorbitant when at Shands. And like I said, hopefully y'all work on that even more.
Well, that's your point.
So
So
they're a Medicaid provider, I would think, like them charging the Medicaid fee, or, that's, and they
Yeah, put
complain
that
that
in.
Medicaid fees.
Is
are high a little bit.
is Medicaid lower than Medicare?
yeah, oh yeah,
Oh, yeah.
They care is older.
It's
And that's why people don't get
indigent
Medicaid.
person applying versus getting something.
Yeah, so, if we tell them that they're going to have to accept Medicaid, will they not take the?
Medicare. I mean, if the Medicare rate is in the middle between that, because that is why I heard they don't do dental. A lot of providers don't do
Yeah,
Medicare.
but Medicare doesn't usually pay for kids.
I know, but I'm saying if it's a rate for a primary care for a senior citizen, that would be their full-blown rate. You're trying to get them out of their full-blown rate.
If they don't take Medicaid, then I don't know if we should.
That's what I was gonna say.
They should be serving that population, it's eligible.
You gotta take Medicaid. I mean, that's what we're talking about right now. We're talking about service people that don't have insurance that qualify for Medicaid. They don't know how to sign up. So making that a requirement of you get the Medicaid rate and after the first visit's free, we'll pay for that, but then you gotta have a navigator to help them apply.
I support that because I think, step one is I'm in pain right now. Get me out of pain,
Right.
and get me back to school, and then get me how to figure out how I don't wait till I'm in this
To get
pain next time
services.
to get
Wow.
services.
That's okay, good. My question would be, will that help us really? I mean, because that's the problem, people don't accept Medicaid. So if they're not accepting Medicaid, we're having trouble getting numbers. Will they say,
I think we should possibly see what we get.
okay,
But I think it would be, when we talk about being good stewards of the money, I think all I can hear is, Maggie saying, you will not accept.
yeah, I mean, I understand it, but
We probably have a handful of folks that do it and are set up to do it, and the rest say, I don't. qualify."
Yeah. Right.
That's okay, and that's okay, I don't want to. Yeah.
Well, and again, if it's giving them the ability to expand their service, to another, like they have a doctor's office, but they're willing to go do clinic hours somewhere else. I mean,
Yeah.
that's okay.
Okay, so what I heard is that we are going to allow, for Medicaid physicians only, who have the ability to serve families, who are uninsured. Apply for these dollars, specifically for that area, charging the Medicaid rate. I hope somebody's on my team taking notes. Yes, I see you. And I'm forgetting something else, but.
They assist them with the plan.
Yeah, the navigation piece.
Okay, all right.
Require them to tell us their plan for.
Yes, and that,
community.
yeah, okay.
Points for.
Are we paying them for that part of it, or are we saying that's part of your admin fee?
Are we paying them for the service or saying it's?
For the
And for the
worker,
navigation.
what are we paying for the worker?
The community navigator? The community navigators, well, the county currently has a fee structure or payment structure for community health workers.
So we would follow that.
All that,
Yeah.
yeah.
And they will be in the office to help these people?
Yes,
Okay.
that would be part of their plan.
Okay, y'all just took us to another level. Okay, that's why we have workshop.
Okay, next slide.
Yeah, that's your fault.
He pre-apologized.
So page 10, in your PowerPoint is wellness. We're back to these navigators, right? So wellness navigators. Funding for wellness navigators is to support existing programs that have positions that are located in settings where youth and children are gathered. For an example, that would be our Howard Bishop. They spoke, it's a great program. Their funding ends. And this is the type, this component of our RFP is what supports the continued effort for that wellness program at Howard Bishop. And as we heard, it also supports the health of that community because the entire community is able to participate.
Well, that's a great program.
Yeah, a great program. Another example of this type of program, and when I say existing, I don't mean currently funded by the trust. I mean it currently exists with or without our trust funding. Another example would be Children Beyond Borders. They have a health component where they're working specifically with non-English speaking families that need access to healthcare. We know there's a large number of those families that don't have health insurance at all, but they have children who need access to care. So those are examples of the wellness component of this RFP. The goal, again, is to increase health and medical awareness by coordinating, connecting families and children to the medical, to the dental. They collaborate with our other providers, our Saving Smiles program. They are collaborating with them to ensure that every part of all of our funding is working together to create a system of care for families in our area. And they've seen some success. They've seen a lot of success, as we heard when Howard Bishop spoke last month, with making sure families are not only connected, but they're getting the care. So that is our recommendation for wellness navigators within this RFP. All right, next slide.
Bust right through that one, didn't you?
Real quick, are you? Because I knew what was next. I knew what was coming. So let's talk a little bit about performance measures. Just in general, we want to know how many children are being served based on what we end up funding. So if that's dental, it's dental. If it's physician screens, we know we're not going to do vision because we see that the data is not supporting that. If it's immunizations, we want to know how much and how the number of children being receiving those services. And then we want to know the number of services being provided as well as the locations of where these are. Next slide. And then we want to know how well, which means we want to look at the percentage of the Alachua County zip codes where the health services are provided. We want to know the percentage, we want to know if families are satisfied. And so we'll do that measured by surveys completed by the patient or the guardian. And then we want to know if they are better off. These services we provided, did it help? Did anything change? And so children receiving routine dental care it'll be measured by parents reporting that they're able to get routine care. If I came to Saving Smiles because my weight to the Medicaid provider or my private health insurance provider, because let's not forget that's an issue also. The wait was so long that I needed to get, my child into a ditches to keep from going to the emergency room. Now that you have been seen, your next appointment is within the time frame when you should be seen again. Did that happen? Are we helping them to establish a routine and a provider? Enhanced oral health knowledge, improved dental hygiene. We have to add more information as it relates to wellness and navigation. There is some navigation there, but we do have to add that. So this is overall how well better off. Next slide. And then we want to look at impact. And we did hear you all. What is the impact? What are we doing? How are we making a difference? When are we going to see? And how are we going to be able to tell the community that our services made an impact and how? So I'm going to turn it over to Bonnie, who's going to talk a lot more about impact. We do want to hear, just like we've had the discussion for the components of this RFP, we want to talk a little bit more about the type of impact that you all want to see. I said a couple weeks ago to Executive Director Kiner, we should have talked about impact when we were working on our strategic plan. It should have been a column. And then therefore, instead of the staff creating a program for us to then determine impact, we would have been creating a program based on what it is you want to see. So I'll turn it over to Bonnie.
Chrissy, before you go, any questions? To performance measures on the how much, okay, you'll have a number. But what we also need to know is what increase is that?
Yes.
How much of an increase is it? And we've got to be able to show people that, okay, we've increased it by 20% or whatever. So, and then the vision service, so we don't have a 0-0.
I did have a question.
Okay.
I didn't ask it earlier, like the health department, do they have mobile outreach? I mean, do they go out to try to increase the number of kids immunized? I know there's probably this mad rush before school starts, right? To try to get incoming kindergartners and the middle schoolers that have to have that. Do they have a mobile clinic that they take out? And I'm wondering if maybe if they do and they don't go out more because of funding, is there anything that would preclude us from possibly funding an extra day of them out or something, without an RFP, like we just work with them to
Like
extend
some
their
kind of
service?
interlocal.
When I reviewed the county health plan, I didn't see, and Commissioner Cornell, you may have more information on this more than I do, but I didn't see anything about whether they had a mobile health clinic. I do know that they will go to different events.
Right.
And offer the flu shot or immunization or, that sort of thing. They have an outreach department that does that. I just haven't seen it. I can't say they don't.
It's on the US mobile outreach clinic, the US mobile outreach clinic. I think it's dental.
I know that Saving Smiles. I was just wondering if it was like something with the health department. And also, I don't know.
The department doesn't have mobile.
They don't have mobile. And so they don't go out and do like the screenings like before school starts to try to meet that spike that comes up.
They may do for flu. They have a program for the flu. Yeah. And they do go out to the schools. I know that they're in touch with the nurses,
Yeah.
but ever since that law change of opting in versus opting out, they've had it's an annual argument.
So, and this is one other thing that I would just to throw out there. We have the College of Med, Nursing, Dentistry, Pharmacy, and I don't know if they do any outreach, but my daughter is a pharmacist and she can give like immunization, she can do things in that, and she's volunteered in that. So I don't know, you might have something in there where if there is like one of the colleges that wants to do some kind of outreach or apply for something, almost kind of like our sponsorship thing. Where they may want to do something as part of that back to school to kindergarten roundup, because they can do that if they're supervised, and that may help us reach people. Like they can put together something that gets the students hours, it gets us connection with the community. I mean, They may not bid on something whole, but it may be something that's small within there. It may be a couple $1,000, it may be
Yeah.
something like that under Grand Hero. I mean, because with the COVID thing, my daughter came home and helped do COVID shots when over in North Gainesville with that, so.
All right. We're gonna turn our spotty and then I'll be done.
I think,
Just went off.
I think, Kim,
Yeah, Martha.
Before we get to impact, why don't we just do a quick motion? Should that be okay? So we have clear direction? Is that what you wanted? So I would move that we implement into the upcoming youth health RFP staff's recommendations and ensure that we add one, require that the providers submit their community health workers implementation plan. And then two, that, we deal with Medicaid providers only that implement a sliding scale and commit to facilitating Medicaid qualification after the first visit. I think those are the two things.
A second.
okay,
And do we want to add a third thing that we ask CTAC staff to contact the UF departments of dental and all that to see if there's.
And Santa Fe College.
Yeah.
That one helps.
That's not part of RP, but just as part of this process that we ask y'all to reach out to UF and Santa Fe to see how we can work together and partner with them and have their interns focused. So,
okay.
three-part motion.
Any discussion? Board, members of the public? There being none, all those in favor of the motion say aye. And do you want to also make a motion, if you don't mind, about having people come from, there's a healthy family, Healthy Start, and make a presentation about the numbers that we're seeing?
We don't need a motion for that.
Yeah.
That's just a request.
Okay, all right. Okay, you've been requested.
Yes.
Thank you.
The outcomes,
Yeah.
so a lot of the
Essays. Yeah, it's a long time for the cleaning.
So a lot of the challenges that we learned from the listening project, we asked parents and youth about help, was the same things we were talking about, the cost, the transportation, the time, language, wait times, lack of providers in the rural areas. So a lot of those, the first column, which I'm sorry, the print's pretty small, but those kind of related back to addressing some of those outcomes that would address those challenges through creating the mobile clinics, having the connector or the navigator to connect families with health insurance. So I definitely saw children and youth being connected with a payer source for healthcare being one of those. Again, sometimes those payer sources aren't exactly always cover all the needs or cover everything that needs to be, but you know, that if somebody came into the a health with the health need that person that we would fund through that position, that would be a direct outcome that children would be connected with that. And it would be something that we could easily measure because they would be right there helping them get that connection with the health payer source. The second one on the outcomes was that children and youth are connected with a primary care provider or medical home. So that would be that they have somewhere that they can regularly go. And that would cover a lot of things because when people go to their primary care, they check all the basics and then they could also refer to a lot of other areas of health, such as if there's a behavioral health concern that comes up, if there's a, obesity or if there's a nutrition concern, a lot of the general stuff, if they're going to that regular healthcare provider, that would be something that we'd like to see that youth are being able to be connected with that primary care provider in the community. That children need a routine and preventative care, that they don't just have the primary care, but they're going to them on a regular basis. One of the data points that is in the next column is that only that at least 29% of middle and high school students haven't seen a doctor within the past year. And we learned that in the listening project as well, that at least 40% of youth are not going to the doctor every year. And that doctor is going to be the one that screens for all the basics, the vision, the hearing, weight, nutrition. Those are all conversations that they could have with kids to pick up things and to kind of get them to where they need to be.
Also in one of the how well measures that you said something that, I think it's, Sheriff Fink said that, what if they're just going through the motions and they don't feel like they've really been listened to? That's why I think that satisfaction survey, even if, you know, it's sent out right after to the parents or the youth to see if they feel like they were heard and listened to during those visits, I think that will be, and it will be something that we'll be able to monitor and be part of the contract, so we can see that they feel like they're heard and listened to, because I think sometimes, I think we've all went to a healthcare provider in our life where we haven't felt that way, and so we can monitor that as part of, to see that things are going well in that way. But I think the long-term impact on the very last column is that, and I kind of stated it in the positive and then stated it in the negative, that youth and that health and wellness is increased for children and youth, and then in the negative, that illness and risk of developing serious health conditions is decreased, and that when we thought about a lot of the health related, you know, getting the wellness, getting the immunizations, making sure the teeth are without cavities and they're taking good health, just routine health practices, that school attendance would increase, and especially school absences related to just basic health concerns, toothaches, you know, getting sick from the flu maybe because they didn't have a vaccine, or not, you know, not just having regular good health habits and good health awareness. So those are some of the long-term impact and outcomes. Thinking of the couple of slides before is more the contract bubble being the smaller bubble, but I also wanted to talk about the bigger bubble being what's the community level change that we want to see at a larger scale, that if we fund, you know, a handful of programs that they're all working towards a shared goal, and thinking of what those are as well. So I put in some community level indicators, and health insurance being one block of that people are getting that children are getting connected with health insurance that don't have health insurance. There wasn't a large percentage of children without health insurance. It was only 4.7%. Yeah, it was pretty small. However, just because you have health insurance doesn't always mean you can get health care. And just because, you know, you don't, and I think we've all are in agreement that getting to the care is of primary importance. So that third measure that they're receiving, their routine care, I think is kind of our headliner one, that they're regularly getting to the services and with the navigators. Some other community level indicators is emergency room visits. You know, if people aren't going, we know if people aren't seeing a regular doctor, don't have health insurance, that's probably where they're going to end up, because when it rises to that occasion, that's where they're going.
But I think even if you have health insurance and it's expensive to use it, and they don't have the money for the deductible or copay, they go to the emergency room.
And there's some other data that I think would be good data for consideration as community level indicators as well. I put some stuff in there that related to dental, reproductive immunizations as routine healthcare that children are receiving. We can obviously, we'll be measuring the service delivery within our providers. And then there's data that could be developed if there's an additional interest. There's Department of Health level screening and surveillance that does go on within the school district, you know, for dental provision for things of that nature. There's you know, there's additional public health data that might be available. We can also have a community level survey that we do every 3 years to ask parents about health, similar to the Listening Project. If there's a particular data point that we really think is important to ask on a regular routine basis to measure not only this outcome area, but additional ones. So I'm open to hearing your reactions about some of these impacts, what you guys feel like would be a good representation, both at a contract level for individual providers and then at a community level, what change do we want to see for kids in this community?
So I think the most important one, I think you nailed it, which is have they visited a doctor in the last year? So I think we should be constantly asking that maybe every 3 years or every year as often as possible. I would ask that, do we know what the school nurses outcomes, like what do they measure in the school system? I don't know. I'm sure they have outcomes that they may measure, maybe the superintendent might know, but I would ask that we kind of reach out to the school board and say, well, because every school has to have a school nurse, I believe. And so I presume that they have certain outcomes that they measure. I would just see if we've gotten those. And then the other one I would add maybe is how many kids did we add to, how many kids were added to either health insurance or Medicaid based on what we just talked about as one of the requirements. That would be something I'd want to measure, because if we had, we added 100 kids, then we know that that's working. And that also, if they know we're measuring that, they'll be more apt to really try to achieve a higher number on that. So that would be what I would add.
I think the dental one, let's put, since we're funding that one, I think, and that is a big one with untreated cavities.
Yeah.
So if we can reduce that, because 39% is that, or untreated tooth decay, is that 39.5% of our third graders have untreated things? Yeah, so that's high. To me, a third,
Really high.
that's really high. We can get that down. That's something I'd like to see us really impact, because if they have untreated dental things in third grade, that's likely a tooth that's gonna, hopefully it's primary still, but kids are shedding teeth earlier and it could be a permanent tooth.
I mean, that was the biggest one that we were worse than the state. The state's 9.2, we're at 39%.
And I think that leads to.
Page 9.
And that one would be one that would be more of a long-term
Right.
impact, that if we're doing this, if they're regularly getting their preventative care, that by the end of the RFP, we should start seeing this trending in a different direction. But for the contract level, to see that the services are being done, they're being done at high quality, we're getting access to the rural areas, and that awareness of good health habits, oral health knowledge is.
Yeah, I mean, that's one when we go back out in 6 years, if we can say, when we started, it was 39.5%. And
Yeah.
after 6 years of focus effort, it's 27. I mean, that's a big one. Yeah, so I think that's a really good measure, third graders.
Everybody ask your questions. Can y'all tell, the student absent 21 or more days, is that for the whole school year, 180 days?
Yes.
Okay, so is there a way to discern how much of that is health related and how much is other related?
I wanted to ask that though, because different schools are able to track reasons, like unexcused, excused, detailed levels. So that was something I was curious.
I don't think the data is consistent, and how they enter it, if it's excused or unexcused, or if it's health related, but you do know the number of days they're not there.
Right.
I just don't think it's consistent. At least that's been my
And I don't think
experience.
that a lot of times it's necessarily health.
Yeah, it's some of it is not. It's a good number of it is not. And before COVID, we had several schools in the district that, I'm gonna say 5 of them, that had really poor attendance, right?
Mhm.
And since COVID, it's like even worse than what it was before, since then. And really trying to really connect with people and just let them know that
School's important.
school is important, especially for the elementary age kids. They just kind of got those kids who were coming into kindergarten when COVID started, and they were doing the high flex or were home for whatever reason, they didn't feel safe to come into the classroom. I think some poor habits developed. Trying to correct that now, it is an uphill battle, but we had 5 schools in the district that pre-COVID that had very high attendance high attendance rates, and they are higher now.
And the other thing is should there be some way of seeing about referrals? You know, how many people, you know, because
Yes, so-
health referrals, you know, that they're seeing something and then referred something out. Would that be a number one, it'd be good to see if there's collaboration was taking part. You know, is that something that is worth measuring or worth pursuing?
Referrals from our,
The primary person, the primary person saying, you know, this is something that you need to do more.
to go to a specialist or something like that.
Yeah.
That's an interesting thought, because I think of it with the visiting RN program, when they reported that people self-reported or came up in the process, I'm also struggling with postpartum or other issues, like one issue, it's sort of like the person who's the worker gets told things, but then the provider observes things and can say, I noticed a skin condition, or I noticed this. So that's an interesting thing to think about. I don't know how you really measure.
I mean, it just seems like to me, it would accomplish two things, you know, number one, that they're getting more than what they initially thought they were getting. And then number two, that, you know, we're all about talking about collaboration.
Right.
You know, this would be, you know, a way of potentially tracking collaboration. If there's some measure that could be, that's feasible. So, and just put it out there. So if you think that there's something that can be done, that would be good to see. If you don't, then I understand. Y'all do this, I don't.
Might not that it's necessarily not good to see, but how would you track it? How
Yeah.
that would be a dependable,
That's
like, seeing it and
Well, our wellness coordinator, contract, we do, they track how many referrals they do for vision, behavioral health, you know, immunizations, they basically they're in that same navigator type role.
But I would say that's a job, that's not the
Yeah.
provider.
Yeah,
The provider is, you know,
yeah.
busy and, you know.
Yeah, and that position's embedded.
Or what you could do is in that, the post thing in the survey, say, you know, where your issues, rectified, and did they refer you to some, or were you referred to something about what you wanted to be treated for, or something else came up?
and I think even with that, if you were referred, the next thing is, did you do it? Right? Because I got no referral. Yeah,
Would that be possible?
everything's possible. I'm freezing, that's what I'm at. Because I'm sitting right up on
When you said that though, I was thinking, Bonnie, you know, we could, it depends on when the survey goes out. Because if the survey is going out immediately to the person who's received the service, then they may have been referred, but they haven't been yet.
Right.
Or they may not have been connected to the referral, so. Then I guess could be a second, if we receive that and it says yes, then it'd have to be another survey. I don't know, a month later, you know, did you go for your second meeting with the additional specialist or what have you? I just think it'll make it harder, but it's not that we couldn't do it.
Was it worth doing? I would think, you know, the initial thing anyway, were you referred to someone else? You know, whether they choose to do it or not, you know, that's, you know.
And it could just take a long time, Lee, because like right now, people are talking about mental health referrals and.
So you get into a regular doctor until August.
Right, yes, it is. Get into healthcare providers here in our town is really getting to be a challenge.
So if y'all think that there's something that's relevant, y'all come back and tell us, here's what we came up with, and, you know, it seemed like y'all want to actually do it.
Bonnie, can I ask about, so all these indicators that, like where we are now, that are become our benchmarks, right? Like, that we want to try to move the needle on.
Yeah, I mean, some might be more or less relevant depending on the strategy and the services we end up funding, so.
But how frequently does that And how, I guess I'm just wondering about reporting,
It would be,
cycles and.
data's behind reality, obviously.
Right.
Some of these are like maybe a year or two old, so yeah, we'd have to wait a few years to see change in the community level indicators. We'd be able to see that we're heading in the right direction based on our how much or how well or better off that people are getting the service, that they're getting connected, and hope to see trends moving in the right direction, but there will be lag in the community data.
I would hope that at least maybe in the 23, there, we've done certain areas, maybe by 23, in those certain areas that we've done, maybe we'll see an improvement. And we-
Or, you know, but also be transparent about where are we getting this from and what was the date? I mean, even a simple glossary to say the source and then the time period, I think would be helpful. Because this is a long haul.
Yeah, hopefully.
Wondering if it would be helpful to have like a Medicaid outreach provider come and talk to the group about what services are available. Because I think a lot of people don't even understand about the expanded resources available through Medicaid, like swim lessons and emergency housing and utility assistance. That's Medicaid does that.
Wow.
They do things, and again, if that kind of information got into the community might go, well, maybe Medicaid is a little bit better. Maybe it's, you know, I don't have enough doctors I can go to, but there are all these other things I can access. And I think sometimes they have care coordination for mental health services. That is, I utilize it for families I staff all the time, just to get a care coordinator that can be that person that can find the provider who's in the area, you know, and having somebody that can hold their hand through that. So I don't know if it's something you all would be interested in for the board, just to maybe have a presentation at some point from the MMA plan that to come talk about this is what we do. And
I mean, I don't necessarily have to have that, but maybe our staff do. I didn't realize they did that because I don't know how much Christy knows that you guys know what Medicaid does, but I mean, I'm not against it, but.
right, it
It would be informative.
or even at the community level, like if you know, they could put together, because there's all kinds of information online, but you have to know where to find it. So
Part of what we are doing will be training for providers.
well, and even the
And that would
navigators,
be
I was
the-
thinking, just so that they can share that information out. So let me know if you want to connect with somebody and
And we could also bring them to, our staff meetings are starting back on the 3rd. And that's, we kind of incorporate professional
I've seen
development
you do that.
into those, so we could definitely have them come for that.
I've had them come
What's
and
the
present at
pleasure?
my behavioral health consortiums, and it's like, it's eye-opening, because every time I think I understand all the nuances, they add something new to it, so.
I think that's the level where you would be most helpful, navigators and.
Yeah.
and providers.
And other programs even, like the, what was that early childhood providers certification program? Like how knowledgeable are they about what's
Available.
available?
Yeah,
Family.
well, that, all of that is part of what our training.
We're gonna lose Ken in about 10 minutes, so, what else do we need to do?
We'll wait to do it until I leave.
Yeah.
Yep, this is the last slide, and so it's just a review of evaluation criteria. Past experience, project plan, agency stability and budget, and we are adding a new component to the evaluation, and that is provider presentation. So
I like that a lot, and I would ask that the provider actually tell you what their community short-term, long-term impact is. We might be able to just lot of measures and be thinking about how they view evaluation.
and then our review process, review and selection process is not changing. Volunteer review team will make staff recommendations for protests, contract negotiations. Funding for this will start, our new fiscal year, which is October 1. So after final, discussion today, we will go back and put the RFP together. And, the final will be presented to you at the April 8th meeting. And the goal is we will have included everything that we have agreed upon to date within the plan, and it would be in the board. meeting.
That's not the case. But when the providers complain that we. That was.
It's extremely helpful. I think that, this is our first one, including this, this part of the board workshop. And I think it's helpful because we don't want to show up at a board meeting
That's great.
in 4 days to fix something. So this gives us a little bit more time.
You can do a presentation on the 8th for this?
So I don't have to do a board meeting if you don't want.
No, I'm just saying, I'm just saying, I'll bring it back
We will
on the 8th.
bring the findings back
Wow.
on the 8th.
That's
And then the RFP will be released, at the end of that week. Within the, packet on the 8th, you'll see the timeline. And so we increased the timeline also for something like this. And that's why we thought it was important to include provider presentations. This is significant, you know, not only in the, funding amount, but also what it is we're trying to achieve. So.
And these will be for 3 years? Any general comments from the public?
Okay.
Yeah.
Yeah, he's asking.
Okay, time's up. Thank you very much. Yes.
Well, I'm Tina Treeler. I am the dental hygienist and coordinator of Saving Smiles. Dr. Olga Enns is our dentist and medical director of the program. And we just wanted to just touch base very quickly and first and foremost, thank the Children's Trust for your ongoing support. I know that many people here are familiar with the Saving Smiles program, but for those who may not be, this program was initiated or came to be from, we have a school-based sealant and preventative program also to Head Start centers, where we provide preventative services, exams for the children of Alachua County. We would then send letters home to the parents saying, these are your children's needs. The parents would generally be like, I know, I just have nowhere that I can bring them. And so Saving Smiles came to be, we utilize mobile equipment. We transported in a van to various locations across Alachua County. Primarily, we heavily focus on rural places as well as the east side of Gainesville. And we try to address these barriers that parents share with us. It is a wide range of barriers, but we are very emphasis on data and what the parents are reporting to us. And the top 3 barriers that parents report to us are cost, insurance, and location of the clinic. Other barriers are dental fear. On the topic of seeing the children in the schools and having nowhere to bring them to receive this care. From the data we collect, we have calculated that about 17% of the children we see have visited a school nurse for a dental problem or have missed school because of their dental related problem. So we travel around to these various locations. This is addressing the transportation and location barrier, going out to rural locations, east side of Gainesville. We also address the number 2 barrier of insurance. Dr. Olga is a certified Medicaid provider, but we will see the children regardless of insurance and at no cost to the families ever. For the cost aspect of it, we've never charged the families a single penny for their care. And last year alone, we provided over $132,000 worth of dental care at no cost to the families. On the broader scheme of this, you know, we talk about the dental visits to the emergency department, and Alachua County utilizes the emergency department for preventative dental care 2 times more than the state average. Alachua County alone in a single year spent about $10 million on preventative dental care at the emergency department. Circling back to the data that we collect from our parents and having conversations, about 52% of the parents that we've spoken with said that they would have visited the emergency room if not for Saving Smiles for their child's dental concern. So we know that we are reaching families to not only address the initiative, the pain that their children are in, they're able to come to an actual dental facility rather than the emergency department. They get an antibiotic and a pain medication, and then they come back a few months later. We have become a dental home for many of these children. We continue to provide them care. We connect with the families, and we're just so thankful for the ongoing support and initial support of Children's Trust.
Yeah. First of all, Dr. Olga is awesome. You guys are great, and we are very lucky to have you in our community. Do you know, does the county direct fund part of the program or does it cap or do you? Or is it all?
Path and choices, that seems to be specifically designated for adults, or persons over the age of 18. But we know that operating a program such as this is expensive and difficult to sustain. So we get support from many areas. For instance, all of our equipment and such was through a grant from the Rotary Club. My salary is through my teaching that I do with it, so it's supported by the state of Florida. So just going into the question about administrative costs or indirect costs, $0 that we took from CTAC went to that. Our funding went to support the salary of our coordinator and a dental assistant. So persons that are directly, all of their time providing clinical care. So you're seeing 2 out of 3 members of our and we served about almost 3,000 kids last year.
So what, go ahead.
Well, thank you, to both of you. I recall you all coming and we extended services. Appreciate the work that you do. I know it's important. I guess, were you here now because of this and wanting to be able to expand? Are you thinking, okay, that's good.
So were you happy with what you heard today?
Yes, I think this was.
Let me rephrase that. Did we miss anything?
I think this was great discussion. If it's okay, Children's Trust has made us better. Over the last few years, we have had these great collaborations with Alachua County Public Schools, Episcopal Children's Services. But through this important, initiative to reach the rural communities in Alachua County, we now have incredible partnerships with, not only Hawthorne, but Waldo, the city of Waldo, Micanopy Community Center, the city of Archer. Executive Director Kiner came to our Saving Smiles out at Archer, which was awesome. And we also serve as a really nice referral resource for several of the other Children's Trust providers. For instance, newborn nurses, Healthy Start. We actually did a little presentation on how to screen for dental problems and provide education for families. We are, I would say, the #1 referral for Partnership for Strong Families, children in foster care who are mandated to have a dental checkup once a year and who are not able to get into a dentist because of all of the barriers faced by providers that accept Medicaid. So I think everything that you touched on was excellent. I 100% agree with this oral health navigator position. There's so many great health services out there that are provided in the schools. Every school year, there's health, vision, height, weight, dental screenings, flu vaccines. And unfortunately, because of this change in the consent process, parents are facing barriers with completing those forms. So I think having a navigator as part of our team can help to promote these valuable and available services. And I also think one thing that I don't think was touched on too much, but it's important that this position be somebody who's able to communicate with families of diverse backgrounds. I would say about 1/3 of the families who we see, their primary and only language is Spanish. Luckily, I speak Spanish, but it would be great to have another person. And so I think that's a very important component of this position, to be able to provide culturally, linguistically appropriate care to the families. Otherwise, other ways that you have made us better is we have expanded to have Saturday clinics because we recognize the barriers that many working families face. And I also today heard a lot about a more comprehensive approach to healthcare, and that is something that we do. We refer to, providers when we see children that might have other health issues. We have actually had a volunteer board certified behavior analyst, volunteer her time at some of our Saving Smiles clinics to help us with supporting children and their families who struggle with autism or other sensory sensitive, disorders, to help to make that dental appointment more positive, and also to help streamline referrals to, for instance, the College of Dentistry's Pediatric Special Needs Clinic if that's needed. Otherwise, you know, we are just doing our best to also, you know, impact policy. Tina and I have public health backgrounds, and this issue with the opt-out, you know, for non-invasive services is really having a big public health impact, because those kids that are at highest risk of these health issues are the ones who are not getting those forms turned in. So we are actually working with this organization called Florida Voices of Health to do an amendment for this Parents' Bill of Rights, you know, statute to help allow these non-invasive screenings to have the consent process, which was in place before. So otherwise, we just thank you, and I hope that you see that this oral health has so many linkages to other areas, overall health, nutrition. We always are doing nutrition education with our parents, as well as emotional, mental health. So we just thank you, and we hope to, you know, be even better, and thank you for investing in children's oral health.
So were y'all going out to the rural areas? And the data that we have is from 2021. So were y'all going out there then?
We
Because
have updated data for you.
Well,
2021.
we're talking about a lot of, so were y'all going out there at that point?
Not at that point. I
Okay,
think we were, our only rural location at that point was Hawthorne, and the program really took off, or it kind of got the wheels rolling about 2021, right after COVID. And so since then we have expanded.
Okay, so hopefully this.
Yeah, right, correct. It did not include it at that point.
And secondly, the referral part, which obviously was brought up and discussed. Is there a way to do it? Do you think?
I think, I mean,
From
at least if we refer persons in the UF system, that is something that can be tracked. But we also refer to safety net providers that are outside of UF. So with that, the best way that we would be able to track that is at their next, you know, their follow-up dental appointment. Were you able to get a referral for this? And we would just have a yes or no. And perhaps the oral health navigator can help to facilitate, you know, any challenges that they face if the answer was no. But I do think that's something that we could track, certainly.
Well, that could be something. And if there's a follow-up, is this the first time you visited, Saving Smiles?
Right.
Yes or no? And if it's a yes, were you referred at that time? And did you do the referral? Did you do the referral? Yep.
That makes sense. Can you say that data point again about the emergency room? Because I was so blown away that I couldn't take it in.
Sure.
$10 million, $10 million.
So in a single year for Alachua County alone, $10 million. For Florida, it was over $400 million. There's a lot more data on other faculty members that we work with focuses heavily on this. For our patients specifically, it was 52% of patients that responded or self-reported that they would have went to the emergency department if not for Saving Smiles for their dental concern for their child. But yeah, it is really mind blowing. And if you would like more data on that, I'd be happy to share.
Just the human suffering involved. Just like-
Dr. Holmgren, Tina, I was just gonna say, we recently opened up CAP to handle kids. And so, if you're not being funded through CAP, I'm gonna try to put you in touch with Claudia, County. Because we need more of y'all, more folks. Yeah. Okay, well, we'll get good.
I will say, because we do dental screenings in the whole, you know, county-wide, and the greatest need is in Hawthorne and Archer. I would say as far as the rural places, Alachua is kind of in the middle, you know, it's very comparable to other areas as far as dental needs in the third grade students.
And unfortunately, the data we have is, it says Archer and Newberry. And then there's two very different demographics.
Oh, that's the one there, yeah, that's, I noticed that, I just thought that was odd.
Well, thank you very much. Thank you very much. Chrissy, is there more? Is there anything else? Is that it? Okay, let me make sure I've got everything. Did, board comments? Any board comments?
I made them all.
Any more, board comment?
I have one question. I don't know if this is a Bonnie or Chrissy, but on page 9 of the slides, and maybe I just missed this under oral health. Are we missing 3 counties data from 2022?
Page 9 of the one.
No,
We might have not, that was probably from, I
Yeah.
don't have it in front of me, but I think it's a state level, I think it's the Florida tobacco survey.
But
that's
it's that
done in
high.
middle school and high school.
No, this is middle and high school students who have not visited a dentist. This shows that Clay County went from 31.1% to 0.
Yeah, I
Yeah, there's something weird in the,
yeah, it was, there were like.
from that survey, but I don't know how they.
They probably just.
For that, it's 1 year, for 2 years.
I'll have to get back to you on that one. Yeah, it's weird. They might have not done it that year. They might have opted out of the survey that year.
Thanks.
If they got 0%, good for them.
Yeah, right, yeah. It's attributed to, I was looking at it wrong, like COVID, the COVID year, but it's not the COVID year.
I thought they didn't submit that. So if there's nothing else, we are adjourned and thank y'all very much, everybody.
Thank you.
This was good. Thank you.
Thank you.